Bindu ma'am, can we start now?
Okay, ma'am.
We'll start. Okay, yeah.
Okay.
Sir is also there.
Yeah. Yeah, I welcome sir and all the participants as well. So, very good afternoon, everybody. I, Mrs. Bindu Jacob, would like to welcome you all to today's series, the third session of the third phase of our Gurunanak College of Pharmacy sponsored organized STTP, which is basically to train the trainers for the entrepreneurship development in the field of pharmaceutics. I feel extremely honored to introduce our speaker, Mr. Yusuf M.H.M. Thanawala, an enthusiastic young entrepreneur, director of Mayon Pharmaceuticals Limited, Nagpur. Having done his MPharm from RTMNU Nagpur, he is a gold medalist in medicinal chemistry. He has also passed Diploma in Business Administration with merit. After having worked with German Remedies Limited for a small duration, he joined Mayon Pharmaceuticals, his family owned homeopathic medicinal manufacturing unit, and has now turned it into a company which has been nominated as 10 fastest growing healthcare solution providers in India, as well as 20 most promising organic products and personal care companies in 2018. This year, that is 2020, the company was inspected by US FDA. So now, Mayon Pharmaceuticals stands tall as the only ISO 9001-2008 certified homeopathic company in central India. So without any time lag, I would like to request our eminent speaker, Mr. Yusuf M.H.M. Thanawala, to share his experiences and expertise of being an entrepreneur, our own Nagpurian. So welcome you, sir, for your deliberations. Over to you, sir.
Good afternoon, everybody.
Good afternoon, sir.
Can you hear me?
Yes, sir.
Yes. So good afternoon, everybody. Welcome to this session of entrepreneurship development program. And I thank you to the staff members and the principal of Gurunanak College of Pharmacy for giving me an opportunity to share my experience on entrepreneurship. Basically, entrepreneurship is a very wide terminology which has been nowadays very effectively used in each and every field, as our Prime Minister is also mostly focusing on development of products in India. I will mostly speak on my some experiences on the pharma background and some of the course which people have given to become a successful entrepreneur. Now coming to stage one, when we pass out from the pharmacy college, the basic idea is not to develop a molecule in 4 years. It means that we have to develop products which are user friendly and it can help in our day-to-day consumptions of what we are facing problems nowadays. Basically what happens whenever a farmer, I will be reading few of the things which I have just collected from here and there. I found this article very important. The professional discussion revolves mostly around regret over choosing pharmacy as a career option. This is the basically whenever you talk with the pharmacy student, वो ही है अरे MBBS में नहीं मिला इसलिए pharmacy में लिया. This is basically the criteria of the pharmacy students, which is still not in Nagpur, but elsewhere also it is happening. Now, pharmaceutical science situation is more like in all parts of the country. Now, I would like to share a few points which would be helpful for a B Farm or hello.
Yes, sir.
That would help the students to just think broadly in terms of entrepreneurship. Now, entrepreneurship doesn't mean that. Can I share my screen, please?
Yes, sir. Madam, you'll have to unmute yourself.
Thank you. Thank you.
Yes,
you can share the screen, sir. You are a co-host, so you can share.
I'm just trying to. Can it be seen?
No, it's not seen right now.
Yeah.
Ah, yes, now it is okay. Uh,
The first point is
so
process of
please do
creating.
the slide share over there so that it is more clear.
It's clear now?
Okay, okay.
Now, the process of creating something new and assuming the risk and rewards. Creation process for entrepreneur and audiences, devotion of time and effort, assuming risk and then rewards. Now, the basic concept whenever we come out to become an entrepreneur, the main important here पैसे कहाँ से लाएंगे? That is the main problem with the young generation as of now. It is not easy to uh, make a fast buck whenever you are starting a new entrepreneurship program. It requires time and it requires proper field work and proper opportunities to do work. Now the inventor, the originator of the product or concept, the person who realizes the opportunity and is determined to engage it, and the project companion, the person who makes things happen. Now, how to identify the opportunity? Going back 10, 15 years back, there are few products, these are like Iodex, or you call it as Zendu Balm, and another one which was Vicks. Now, these three products, Zendu Balm, Vicks, and Iodex, had just taken the market by storm. Does these three products require any rocket science? Does this three product had something innovative in it? It was just produced in a lab, and the main concept of this product that it could heal multiple diseases with a single product: pain, arthritis, headache, migraine. So these products which were taken by storm during that period of time did not require any rocket science, but only the concept to attract people, to attract masses, that was important. It is not curing any disease, but it is giving you satisfaction at a very low cost. So my point is, whenever you come with an idea, one thing is important: it has to be cost effective. Second thing, it should serve multiple purposes. Third thing, it should be in the arena of the masses, so that the consumption of the product is more than a stipulated masses of people. Now, students who are working or who are planning for an big entrepreneur, being starting their own unit, has to be very much disciplined in their what they have to do. Now, you don't have to keep waiting endlessly for job and then a promotion. Younger generation can come up with most novel and innovative ideas, which leads to new products. Develop products that are effective, affordable, and quality oriented. Provide employment to others, extreme job satisfaction, and save yourself from corporate politics. That is also very important. Motive for entrepreneurship: increasing pharmaceutical service availability, improvement of quality of services, reaching the unreached areas, meeting the unmet health related needs, optimizing the cost of health services, particularly for medicines, and providing a room of self employment of pharmacy personnel. In this aspect, I would like to quote my example. I started my career as a pharma, means in the year 1992, I got an admission in Nagpur College of Pharmacy. Then I post-graduated from Department of Pharmaceutical Sciences. In all the 6 years of my pharmacy career, I had no opportunity or any idea of how to prepare homeopathic medicines and ever homeopathic medicine works or not. It was a very challenging and very difficult task for me to join the very small business of my father, who were manufacturing tinctures and homeopathic medicines. I don't know, still people are much aware as how to manufacture homeopathic medicine, or does it works or it doesn't work. And when I did my project under Dr. Badodkar sir, I had taken a subject of phytochemistry, keeping in mind that my area of interest in future would be dealing only in plants constituents, nothing else. Because I had made up my mind that I had to run my small factory and take it to the great heights. Giving you examples of many other people who have started their career from scratch, this, I would like to give you an thought on what I believe in my life history as how I started. Now, when I took an example of Craticus oxycanthus, this was a plant berries which are very widely used in homeopathy for cardiac disorders. Nowhere in the our pharmacopoeia of homeopathy has mentioned how it is working or its essay, nothing. Now, when I approached Varodkar sir, he just said that you have to do it on your own, because I have also not done much on phytochemistry. Now, after analyzing everything, what he taught me, anything, that is all history now. I just passed out my uh, uh, MPharm, and I gave exam of GRE and TOEFL, which I cleared. I also got the admission in Oklahoma University of the US. But unfortunately, my father told that if you go out, then our factory, we need to close it, because the funds were not so much. And yes, going out at that time required a lot of funds, though we had a scholarship, but going out 20 years back was not easy as it is right now. That was a well that at that time I took my decision that yes, I should run my own factory rather than going out studying and then going for a job in the big multinationals. That would have fetched me great rewards, as I knew my subject very well of what I am doing. When I started with my factory, I was every time very much unhappy because I could not produce things which I had studied. I did not knew anything. What is the mode of action? How these dilutions are working? What is the concept of mother tinctures? Nothing. There was nothing. I mean, for a couple of years, I just used to just sit in the factory and do nothing. Means there was nothing that would have excited me to do. Then I started from production. I went to market. I surveyed almost whole of the India, visited so many pharmacies, visited so many doctors. The only concept of doctors and this, how much you will give me discount. The product does not matter to us. The only thing that matters to us is how much incentives you are offering, and that was the criteria 20 years back. Today also we are fighting with the same protocol. In this, still very much unsatisfied with the what I was doing, I started looking out for big multinationals so that I can manufacture for them and a loan license. In that, there was a problem that in our Drug and Cosmetic Act 1940, there was no provision for loan license manufacturing under homeopathic medicines. Now, the problem is that big MNCs, they don't want the name of the manufacturer if they are manufacturing from the third party to come on the carton. Now, then again, this was a big hurdle which could not be overcome, and it is still pending. In 2004 or I think 2005, I wrote a mail to Cipla regarding if they can help us with some of the products in herbal formulations for exports, as it is a very big multinational manufacturing, ethical as well as pharma products in India. And it was very difficult for them to digest that herbal medicine works. And there was a mail from some of the HR people from that company that they are interested in herbal. So we took the opportunity and I tried sending them mails, giving them our scope of how we can work. As you know that MNCs, there are, if they float an inquiry, there are hundreds of people who try to approach them and give their best. And fortunately, after consistently following up, we were invited for an interview that how would you help us? In that also, they shortlisted around 5 to 6 manufacturers of herbal medicines, which they were looking for. And somehow I was able to get the email ID of the CEO, Dr. Yusuf Hamid. And instead of following up with the people in the HR and all, I directly mailed him to him that, sir, we are manufacturing of this, and we would like to seek an appointment with you. So in this process, after around 6 months, we got an opportunity to meet him. And he said that we are not interested in this herbal medicines. But my colleague, there was another CEO, Mr. Amar Lula, who said he is interested. And if you want, you can visit him and meet him. And yes, it was an really a nice opportunity to meet him also. And he selected, first question is, he asked me, and I remember sitting just opposite side of him. He said, how can you, what is your USP? There are so many people coming here and they are sharing their thoughts that we have so much. I said, sir, my USP is my knowledge. I have a very small factory in Nagpur, and if you inspect that factory, I think you will not approve my manufacturing unit for your products. But I can offer you products which no one can offer you with that therapeutic efficacy. And to my surprise and I don't know what at that time I said, he was very much impressed and he gave an opportunity to work with Cipla. He selected 12 products from my manufacturing unit and we started working with the MNC called Cipla only for exports. Now, my point of sharing this story with you is not that I am boosting myself or what I am doing. My sharing my stories is to find the opportunities which come in life and you have to grab it. I had no opportunity when I did my I found that what homeopathic medicine would help me. When I wrote this to this multinationals, I got an opportunity and we got a very good business. And today, what we are and what he taught us, it is coming in day to day practice. I would also like to share one opportunity of a very leading commentator, Harsha Bogle. I don't know whether Harsha Bogle is a very famous, but some of you who are not interested in cricket might not be knowing this. The very interesting story of his was he is an IITian. When he was giving his lecture, he shared his story that after passing the examinations, the list was on the board that who all have qualified. He told his father that everyone's name is there. My name is not there. I don't know how. What his father told that it might be a printing mistake or they must have left out your name. I will just call the. He had some contacts in the IITs. He said, just I will call and find it out whether your name is there or not. To his surprise, they had forgotten his name and his name was there in the list of the meritorious students. That becomes one part of the story. The other part is also very interesting. He said that when the interviews were taking place, everyone's name was there who had qualified, then my name was not there. And that interview, the IITians, no, they can interview in a big hotel, and there are actually group of 3, 4 people who are sitting and taking your interview. He again went to his father, being very scared, and placed the same example again. Father, my name is not there, but my other colleague's name is there. What should I do? He said, do you know where they are put in which hotel? You call that hotel and ask one of the interviewer to say whether your name is there or not. He was very scared. He was young, maybe third year engineering student, but still he said that okay. He called very scaredly to the one of the person who was taking Mr. So and so the interview. He said, "Sir, I'm so and so, and I just wanted to know that my name is, it had happened earlier like this, and I just wanted to know that whether my name is there or not." To his surprise, he asked him that, "Who are you?" He said, "I'm a final year student and my exams are scheduled day after tomorrow. And if my interview is there, then I have to just miss my exams and whatever that must be done." The gentleman told him that, "Please give me tonight time. Tomorrow morning I will." He took his number and he said, "If there is any such thing, I will just call you tomorrow morning." To his surprise, the gentleman called him that, "Harsha, your name is there and I have rescheduled your interview today because you have an exam tomorrow." Now, the point of telling this story is that Mr. Harsha Bogle created an opportunity for being himself and calling up the fraternity that, "Is my name there?" If he would have been scared or if he would have been shy, the opportunity would have gone. So, this is the very big example that you have to have self confidence in yourself that, yes, I can do it and I have an opportunity. Things are very difficult nowadays. The competition is too high. So opportunity comes your door, you have to grab it. You have to understand that this is the opportunity. Same, there is one more very good example of IPL cricket. In 2007 or 8, I don't know which year it is. Actually, the first IPL was won by Rajasthan Royals, which was again Mumbai Indians, and Shane Warne was the captain of Rajasthan Royals. And Mumbai Indians, the first, I think they batted first, and the score was around 150, 152, which was very achievable in that period of time. In an interview, I think Sanjay Manjrekar or Ravi Shastri, there were Rajasthan Royals were 85 for 5, and Ravindra Jadeja and I don't know which other person was there. He was asked the question. Ravindra Jadeja at that time was just 18 years old, and he asked that, the commentator asked him a question that, "What made you? Did you think that you will win from 85 on 5 to 152? What was going in your mind?" The answer was,
Sir, you are not audible.
There is a loss of connectivity, it seems.
Yeah, yeah, yeah. Okay, I'll call him. So please unmute yourself.
Yes. So the captain gave him so much of confidence that they won the match. So it is like this, when you are out and if you want to achieve something, then definitely you have to have a very disciplined and a competitive. I'm able to share my screen.
Yes, yes. Just wait, sir. Yes, you are a co-host. You can share.
So this is how means uh, the self confidence has been inculcated in the boys. Same way your teaching profession, you have to start inculcating entrepreneurship rather than giving them an thought that if you score good marks, you will get higher achieve placements and whatnot. See, for our, as far as now, there is so much scope in this pharma field. And if after this COVID virus, the scales for our field has increased a lot in different arena. Pharma is not only that manufacturing of medicines. See, manufacturing of medicines are important, but pharma doesn't end there. There are FMGC products, there are food supplements, there are nutritional supplements. Developing of a molecule happens once in a decade or even, I think, much more. So there are concepts in which there are development of products, research and development, and then FMGC product. Qualities of an entrepreneur. The first thing is discipline. Discipline is very, very important. Discipline comes around means coming, have a very regularized manner of working in your factory. When you open a factory, you are not only the owner, you are the worker. You have to sweep your factory, you have to manufacture, you have to see your accounts, you have to see your marketing, and you have to inbuild confidence in your team. That is very important. In then open mind, self starter, competitiveness, determination, strong people skills, and strong work ethic and passion. There is, in these are the qualities of entrepreneur, but this qualities has to be instilled by the college people. You have to give them discipline, you have to give them confidence, you have to give them how to start, means how to boost yourself to starting a new manufacturing unit. You give them, and I think, I one thing I would like the farmer sector of this colleges to, whenever you have a gathering or whenever you are proposing a pharmacy week, there has to be one such uh, what you call project in which you have to give students that whoever makes a best product or concept of the product or whatever means uh, as per market research, you can develop a product, will be rewarded with this. We give quiz competition, we give fashion shows, we give what we do, but we fail to understand that to motivate people, we have to start doing things from our college. Then only you would, then only the interest of development, how to design a product, how to put in the market, what are the USPs of your product to keep in the market, how you have developed, what team you required, which segment of team you required. Did you require pharmaceutical people? Did you require medicinal chemistry people? Did you require pharmacognosy people? So, like when you give when you go for a competition, you give poster presentation. Poster presentation is very common. You come up with this idea. Whoever gives me a good product, it is not that they would be rewarded with commercial side, but they would be rewarded that at college level, you develop this product and I give the certificate for him. His or her resumes will carry a little bit weightage. Then I participated in quiz. Then I participated in fashion competition. That I won a cricket at my college level. These are soft skills which are developed and which are instantly developed among the students who are studying because they like it, they are towards it. The focus is what we are today, what why we have gathered is how to develop an entrepreneur. How will you develop unless and until you instill that quality feelings in them? Unless and until you try to teach them that you do this, you develop a product, you give them the categories. These are the categories, or if you have of your own category, then also you can present. This would help them to at least start focusing on the manufacturing side. It is not very easy that a single person can open a manufacturing unit. There has to be two, three people who can combine and come up with a good manufacturing unit. Because nowadays things are difficult, finances are difficult, your uh, get managing skilled staff is difficult, handling labor is difficult. So these multitasking things can be happen only if you have one or another subordinate. Think like everybody cannot become an entrepreneur, but yes, each batch can give out of, in 6 years, even if they give one entrepreneur, that 6 year can work with them. There are so many opportunities like this. But yes, you have to develop specifically all teachers. You mark this point. You give them a project. You give them a project in any pathy, naturopathy, Ayurveda, nutraceuticals, cosmetics, what food. Tell them, give him that project. Give a different project for final year B Farm. Give a different project for masters qualification. That will help them. That will really help them to think out of the box. Because when you are thinking out of the box, when you are studying, so next 4 years, yes, मैंने ये किया था ना, iodex. Iodex we teach in first year. Um, we had a practical in first year how to prepare iodex. You know, iodex is today every house, almost every house must be having an iodex. Maybe the color has changed from iodine color to the white color, but iodex is same.
Mhm.
So these skills which were developed, it was only in this section. So I hope you are getting at this point. I just remembered that this I had to share, that giving a pharma project is a key. It is a key, and you have to you should sit across the table, all the teachers with your professors and with your principals, and think about it. I think it will help you. It will help you. I think you will also learn. Even if your student come up with a good idea, we are learners. Today my staff also gives me a thought, sir, we would add this, a product will be much higher. It doesn't hurt our ego. Now we are all a pharmacist. You will also learn out of the box. You can share your thoughts. What you are teaching, you can bring them in practical. Yes, this can happen, anything can happen. Miracle happens overnight. It doesn't require any rocket science. Only thing is your focus has to be there. Focus is very important. Focus, determination, and discipline. These are the three keywords to success. In my life, I have gone through this. You have to slog yourself day and night for achievements. Nothing comes easy. Today you have been teaching every year, same syllabus, same thing, same. But you are before going to the class, every day you are also going through it. What I have to teach here? Though you must have been doing since last 15 years. Kale madam must be teaching microbiology from so many years. I was as a student, but today she must also be revising months before going to the class. So this is how we are learners. We have to keep on learning. You give them project. Every department should give a project so that the development skill starts working in them. Their brain starts working. They don't rely on notes. ये notes अच्छा है ये पढ़ लो. You create yourself. You give a separate section for that. By 10 marks is for creativity. What you develop, what you do. This is for you. Practical out of, I think at our time it was 10. Maybe you divide into 8 and 2. 2 is for creativity, 8 is for your theory. Am I right? This virtual, no, it is very difficult for me to give virtual lectures. I cannot just understand because I don't see the faces. I cannot see what I am speaking. I really getting into your head or not. Physical appearance is always better. One-to-one meeting is always better. You get to know person how he is.
Yeah.
The low points of an entrepreneur, money should be not the only criteria. Money, for example, 6 months back, sanitizers were kept on the corner of any shop. Dhul kha rahe the. But suddenly after what happened, Corona, sanitizers came in demand. People started manufacturing sanitizers and selling it enough, any cost, whatever thing people, what they have sold, I know. I don't want to highlight here, but money should not be, we are lifesavers. We are lifesavers. We have to have that oath with us that yes, money is important, but you cannot play with the products. The other person is using it tomorrow. Maybe your parents, maybe your brother, your sister, maybe using it. This substandard products. Money should not be the only criteria. If that is the criteria, then I think you are not fit for at least pharma profession. Pharma profession, an entrepreneur of pharma is really different from other hundreds of sciences or hundreds of other entrepreneurs. Responsibility for the good and the bad. Responsibility of the good. I think this responsibility fact of a good product, and you must be teaching in that. I think in Pharmacy Act there is this subject of responsibility of a product. I don't know. We have been never taught, but yes, whoever manufactures the product, it is their responsibility that whenever it is in the market, good, it has to. If it is bad, it has to be recalled. If it is good, yes, you are happy that yes, my product is moving. Risk and decisions can backfire. Yes, every time you cannot be right. Every time you cannot be right, but you have to risk. It is a saying: no risk, no gain. You have to take risk. Without risk, there are no gains. As an entrepreneur, you have to manage all departments. Yes, you are the, I think you are not the owner, but you are the biggest labor of your factory, because from your management decisions to the out product in the market with the customers, you are responsible for what is going around in your factory. No fixed time for work. This applies to teachers also. This applies to teachers also, and I know that teachers are really working very hard. As of now, I have been associated with so many colleges and so many colleagues of mine. They are all means devoting so much of time with this new online classes, arranging online seminars, requesting people to guide the students. It is not easy. It is not easy to do things which are offline. See, physical appearance, physical teaching and teaching. I don't know, my speaker is on, my camera is off, the student is not there. Ma'am, camera is not working. Maybe he is doing something, but he has put his attendance. So these are all difficult times which we all are facing. And yes, all of will come out very fast from this. And we have learned another method of developing skills, soft skills among the students. I don't know where this online things will help them, and where they can use these things to means uh, in their feed. If you are a marketing head, you can just go online with all your field staff in the various parts of the country, and you can club them together, and you have an online meeting there. You save so much of funds of visiting there and going to them. You can create online conference for doctors. You can show online slides on that. So these maybe today we have opened another era of marketing or online series of lecturing. And so what, one more story I would like to, this is my, I would call an unsuccessful story at my end as of now. But yes, success stories always people share. But this is, as of now, it is still unsuccessful, but it is an achievement for me. What happened in 2019, I had sold around hardly around $10,000 of product to US. And in 2018 and in 2019, they said that we would like to inspect your factory. So when US FDA comes, means it is so difficult to understand, and it is really very difficult to, it is just out of the box. US FDA is always a dream for any pharma company. Maybe in Vidarbha, there may not be a single company who has been inspected by US FDA right now. When 2019 they wrote me an email, so I also inquired around my friend circle and how to go about it. Everyone said just tell them that we are not interested to sell any products in US, and we would not like to inspect our factory as of now. So this was almost 100% people told me like this. There was no hope. Then anyone didn't give any hope that yes, it is good that you are getting inspected. So, going by the rules of nature, I also said, yes, I wrote to them that, yes, sir, we are not interested and we would not like you to inspect our factory, and we would not be selling the products to US as there is no much market there. But in December 2019, they again wrote us a mail that we would like to inspect your factory in January, from January 14 to January 18. And uh, uh, if you have any objection, you let us know. Then again, I asked my US client that, sir, it is very difficult. We cannot face them. It is not right now. We are not prepared for them. So my client, he was also an Indian. He said, "Wait, I will send my person from India to inspect your factory and to see whether we can qualify for or not." So he sent some persons. He said, "No, sir. At present, it is very difficult for them to face this inspection." So again, we wrote the mail, sir. We would not be able to face you, and we are not ready for it. So we wrote a denial mail. But yes, they again wrote us that we would inspect your factory next month. We give you 1 month time. And from 17th to 20th February, we will be there. So things got very difficult, and it was very much, means it was a very tough job for us, getting ourselves to be inspected by the highest authority of the world. And it is not easy. Uh, After going through the inspection, I would say that it is not at all easy. Even big companies have avoided this, but still, now the ball was in our court and we had to face it. We had a really in 2000, in January 12th, I think we got a final mail from them that we are going to come on 16th of February, and this is our protocol. This inspector will come, and you have to manage you the inspection at your end, and you don't have to pay anything. Means everything will be arranged. You just give us where which are the big five-star hotels in your area, and that's it. I started renovation my factory from January 12th. It was a very difficult task. Difficult means we started from minus 100, not even zero. We started from minus 100 to upgrade our factory. With that, 26 days were like 26 years of my slogging, which I did, and we did as a team. not I would, I'm sorry, I'm saying I, it was not I, it was we, from my laborers to my office staff to my wife, and everyone was involved. And we hired a consultants, and we on we took colleges help uh, for my personals. And yes, on 26th of February, means we had heard from people that they come, and if they don't like, they even lock out your factory and go and say that sorry, you cannot manufacture on. There were so many of negative thoughts which were running across for 26 days that it gave me sleepless nights, and I don't know when was night and when was day. It was such a worst, I would say, no, I would not say the worst, it was such a learning period of my life, that things can happen if you are determined. If things can happen, then 26th when he arrived, he called me that Mr. Yusuf, I am here, and I want you to be get picked up from my hotel at 8:45. I would start the inspection right at 9:30 because that is your factory time. And that 5 days, mind you, was like 5,000 years for me. Morning 9:30 to 6 without any breaks, we used to just answer him. Just answer him. Unfortunately, US didn't have any guidelines how to inspect a homeopathic manufacturing unit. They inspected us on the level of a pharma company. Now, pharma company and homeopathic manufacturing unit, even they are not very close also. Leave that we are not close also. During the whole inspection of 5 days, he gave me 5 observations which I had to rectify. None of the observation had pointed out on the infrastructure of my factory, and that was an achievement for me. None of the observations were on the infrastructure of my factory, the facility of my factory. It was only on the technical grounds, and technical grounds were such that no one today also can rectify that. If you have little knowledge of homeopathy, he said you have supplied Natswamika to our country. Natswamika is a banned drug, or it comes under Schedule H in US. We told him, sir, Natswamika we have supplied to the dilution of 10 to the power 6. And if you analyze it, you would not find strychnine even 0.01% in that. The, the only thing is, he said you should mention in your COA, your certificate of analysis or your batch manufacturing record, or you report negative. If it is not positive, you report negative. Now, we never in our things on the BMR or batch manufacturing records of the, we don't never means it is not in our curriculum or our cosmetic act, drug and cosmetic act to report negative. Whatever we say, whatever we get, we report it. If we don't get, we don't report it. So there are many things we learned. He went, he gave us an observation, he gave us time, and today, though we are not yet qualified, but that is still in process, and probably it will take another year for me to become the first company in Central Asia to be passed by the US FDA. And it is now my dream that I have come so close. I have to achieve it now. In fact, it is the first company in Maharashtra to be inspected by US FDA. If you search, there are hardly any companies who, only big names you will see, Cipla, Zydus, Torrent. So the point is that though this things was never expected, and it came just by luck, or would say that it just came that we want to inspect. I had never, generally you give a proposal to the US FDA that come and inspect my factory. We had never proposed, No, we had intentions of selling our products there. It came, we achieved the inspection, still it is pending. But my point of view is that though we could not achieve that, because of that, we got registered ourselves in other countries that yes, this plant is inspected, and we don't find much of the intricacies regarding the infrastructure in this. So, only thing is that your determination, your enthusiasm, your what you say, your intentions, yes, I can do it. It was, though it is not possible, you had made an attempt. Attempts never goes, attempts are never, if 10 times we fail, one time generally, finally we will achieve it. So, and our profession is such that you have to see failures to see the success. It is not that one stroke and you are through to everyone. So, our is the India is the fastest growing healthcare industry. It's only the entrepreneurs who have made India's world largest generic exporters to the world. Today, after China, people are looking on India for APIs and all. India is the hub for herbal products. People, the whole world is looking towards India right now. There is so much of scope. Pharmacognosy is a subject of interest. As of now, it has the maximum scope because people are moving more towards herbal medicines rather than depending on synthetic drugs. And coronavirus also gave us opportunity to develop new herbal medicines, which is effective and increasing the immunity of the body. Healthcare is the most happening and the most needed market, which requires a lot of ideas to improve the current situation of healthcare in India. If you see in lockdown, healthcare was the only profession which was working. And we are also frontline workers, but unfortunately, we not much recognized as the doctors. But if we are not there, then how is the drug going to be there? Why are not we frontline workers? Why don't we indulge ourselves in the to the government that why pharmacy people of pharmacy are not frontline workers? We are putting our life at risk in manufacturing drugs, facing so many people at a time. Even in this area of lockdown, we were the ones who are manufacturing and giving people the best what we could do. Now, idea may be based on common needs. Common needs. Sanitizer is the common need. Hand wash is a common need. The expertise and experience of the entrepreneurs, solutions to everyday and or existing problems. We are the solutions to everyday and existing problems. You have come up with so much vaccines, the day-to-day healthcare and immunity products, nutritional products. An idea is generated, an opportunity is taken. Now it's time to act. Resources need to be gathered. Limitations and plus points need to be noted and worked upon. After execution, patience is the key. The last point is very important. After execution, you need patience. You cannot expect success overnight. You have to wait. You have to really wait long for you to get successful. The secret to go ahead is to get started. You have to start from somewhere. You cannot just uh, depend on your luck, that your luck will favor you one day. We are not dreamers, but we are doers. If we do, we can dream. If you don't do what you can dream, you cannot dream. Being an entrepreneur means to have an insatiable thirst for learning, evolving, and creating. This is simply no one end goal. Yes, we have to learn, we have to evolve ourselves. We need to create things for the well being of the society. We need to help people with our best formulations, with economical products and therapeutic efficacy. This is how a small and a short story on becoming a successful entrepreneur. I hope I have given you some thoughts and some points to work on. Thank you very much.
Thank you, sir. So, dear participants, if you have any questions and queries, you can ask Yusuf sir. Please come ahead with your questions.
It was really a wonderful presentation, sir, and very practical and giving insight into the opportunities. Really good.
Thank you.
Yusuf sir, inspiring journey.
Yeah.
Thank you, ma'am. You are also a part of it.
Participants, do you have any question? You can ask Yusuf sir. Chat box. Okay. No.
Sir, I have got a question actually.
Yes.
I mean, during this ongoing COVID pandemic, as compared to the Ayurvedic and the allopathic drugs, how effective is this homeopathic medications against a virus, typically this COVID?
If you remember, the government of India had given a publication on arsenic alb.
Yeah,
Arsenic alba.
yes, sir.
Arsenic alb. But yes, we cannot deny the fact that arsenic alb is really a remedy for that. But the long term of arsenic alb gives a side effect also. So, according to us, arsenic alb in combination of 2, 3 more drugs can give a better result than what arsenic alone can give. As far as comparison is there, I would not like to compare that both the pathies are individually significant in their own way.
Mhm.
The concept of Ayurveda is that they gave an immunity booster basically on the ancient theories what turmeric and this giloy and all these people are depending upon.
Yeah.
But our science mainly depends on the well-being of an individual.
Mhm.
Well-being of that individual means your mind has to be more ready for the body to take up all the means whatever comes in the path. So if your mind is strong, then only can your body can fight. If your mind is under stress, your body cannot fight. If your mind is fear that मेरे को corona हो जाएगा तो वो हो जाएगा. See, we play with mind rather than on the all pathological this. So whatever we give, arsenic 30 is basically your mind is working to fight against the disease. That is the concept. We work mainly on mind basis. Yeah, it is very difficult to give you the mechanism of action as you give in synthetic drug.
Synthetic drugs.
Yeah, so yeah, basically it is your mind. It is all mind game. Once you see what is motivation, it is mind game. You motivate your out of this 100, once get motivated, our game is over. One is motivated to open a factory, 100 will follow him. That
Yes,
is important.
correct. Absolutely, yes.
Ma'am, Advaik Burle.
Yes, he wants to ask some question. Advaik Burle, Chandrapur, I think. Yeah. Sir, you can unmute yourself and can ask question. Advaik, sir.
In the chat box, I'm not able to see any question. Yeah.
Oh, he's saying no question.
Okay.
It must be my mistake, I think.
Okay.
Um, sir, I want to ask you one question about the tinctures and extracts. How the standardization norms are then followed? If USFDA approves it, tinctures and extracts for these homeopathic medicines?
Actually, frankly speaking, we also came to know right now after the inspection, US have no guidelines for that.
Hmm.
For example, for them, belladonna is a poison.
Yeah.
And if you consider homeopathy, belladonna is a day-to-day remedy for headaches and migraine.
Yeah.
Naxomica for us, it is a day-to-day remedy for stomach upset.
Hmm.
They see the phytochemicals. Strychnine is poisonous for them. It is poisonous for us also. But if you go on a dilution, strychnine is not there only.
Yeah.
And the problem is that
Potency matters.
potency matters, no. And problem is that with these people, no, they always think above us. you cannot argue with them. Okay,
Yeah.
sir, we will do it. That is, see, if you are ready to accept that yes, this can also happen, then we can argue. Yeah, the question of argument doesn't come. Whatever we say is right. That's it. That is a basic problem.
Hmm.
And unfortunately, we only have created our name such way. That is why that is a problem.
But there are
So
no such written guidelines
there are no such written
for
guidelines.
this.
See,
Okay.
what tinctures are what? Tinctures are basically our pharmacognosy. You see, Brahmi, you see, or strychnine, or Naxomica, you have strychnine. Belladonna, you
Yeah,
have
yeah,
atropine. So, see, pharmacopoeia of homeopathy, pharmacopoeia of India doesn't specify any basic criteria for tinctures. That is the problem. The whole pharmacopoeia had to have to be get again revamped into new one. Even if you see the
yeah,
pharmacopoeia of US, they also have not mentioned right now. I was
yeah.
last week. I was under the NVISA. This is the NVISA is a regulatory body of Latin America, and
Hmm.
they have a very good uh, market for homeopathic products. So I was one of the speakers there, and they also had the same problem that Europeans don't accept this way. That is the problem.
Ayush, I think, has given permission for some of the
Yes.
extracts and tinctures of some of the drugs, particularly in this COVID era. है ना?
Yeah, 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 yeah. See, this I told you, no, this last 6 months has opened the for our so many sectors. Even people from the government are now looking towards homeopathy and Ayurveda in much a higher segment than
Hmm.
what they were used to even last year, I would say. Six
Yeah,
months
yeah.
changed the world for the whole pharmacy world.
Surely, definitely.
Okay. Thank you, man. Thank you very much.
Thank you, sir. That was an immensely inspiring
Thank you,
interaction that we had with you. Especially this hour was an interaction with an entrepreneur. And thank you for sharing your experiences, all the practical difficulties that you have uh, gone through, and the what we can say the space and the stage where you have when USFDA came rushing onto you, and you are going to be a global leader and we can say in homeopathy, and we are proud of Sir Mayon. We are very much thankful for all your endeavors, sir.
And the
Uh,
future is bright.
yes,
Yeah, yeah.
sir.
Future is right. Thank you.
Yes,
Thank you
sir.
very much.
Yes.
Thank you,
Thank you
Yusuf.
very much.
Yeah, thank
So,
you. Thank you.
Kaya
we'll be
madam is
looking.
there.
Yeah.
Kaya madam wants to say something, I think.
No, no. Thank you. I'm saying thank you and best wishes. Okay.
Thank you.
Yeah.
Thank you, ma'am. Thank you so much. Thank you so much. Thank
So
you.
we'll be looking forward, sir, for your, I mean, more interactions with you and
Very-
having better expertise and learnings from you. So thank you very much once again.
Thank you very much.
Thank you, sir.